Having a chronic disease doesn't mean you shouldn't travel.
Buy your medication ahead of time. Don't assume that, oh, when you get to your destination, that is when you're going to buy your medication.
Go for a health checkup before traveling. That's even the most important thing.
If I'm traveling, for example, and something happens on the road, there's no health facility. How does my health insurance cover for me in that situation? Charge your phone, even though you don't intend to use it. Just ensure your phone is well charged and that you have airtime. Load your phone, buy like 2,000 naira airtime, just load it and keep.
The first thing to pack, not just your clothes, is your medications, which are very important. Pack it in a way that it will be very handy when any emergency or anything arises on your way.
Welcome to the Deep Travel Show. My guest today is a health practitioner and she will be unpacking for us tips on how to take care of your health if you have a chronic illness when traveling. Welcome to the show, Mercy.
Thank you.
So let's start with, what exactly do you mean when you say chronic health? Or first of all, let's even analyze the word chronic. What exactly does it mean?
Okay. Chronic can be whether a disease or illness, but something that must have lasted for a very long time.
Like how long?
More than 3 months, or you can't specifically say 3 months, but something that has lasted for a very long time is called chronic.
So if I have catarrh and cough that has lasted for more than 6 months, I have chronic catarrh and cough.
Catarrh and cough is not an illness, not a disease, but a symptom of a disease.
So how about if I have, say, diabetes, for example, and I've had it's been there for a couple of months?
Let me go back to saying you mentioned of a disease now. You said diabetes. Yeah, diabetes is a chronic disease.
Whether it lasts?
It's just a chronic disease. Type 1 diabetes, type 2 diabetes, juvenile, and the rest of them. They're all chronic disease.
Okay, so now that we have a better understanding of what chronic means, which is something that has lasted for more than 3 months. So for somebody who has a chronic disease and they are traveling either by air, by sea, or by land, what are the biggest challenges they are likely to face?
First off, I know persons with chronic illness or chronic diseases, first off, they are scared. Like, they're anxious and they're scared about, okay, what will get to happen to me, or what will be the outcome if I get to travel and all that. Having a chronic disease doesn't mean you shouldn't travel or you shouldn't go to wherever you want to go to. Okay. Having it in mind that you've already prepared yourself. You've already gone for your regular checkups with your health, with your doctor or whoever that is in charge of such, and you have everything you need to travel with. You're good to go. But I know there are still challenges, and I'll be talking a few of them. I'll be talking about a few of them. Now, I know that one of the challenges can be whether you're traveling. Let me come with traveling by land. You might have this challenge of the access to healthcare facility, whereby you're traveling and the distance at which you're traveling, you might not really get to see any healthcare facility or any hospital you can move in if any emergency arises. Okay. Yeah. Another thing is definitely, if you're traveling, you're going to be susceptible with other infection. Let me use this as an example. For someone that is asthmatic and you're traveling by land, if you're not well equipped, like you're not well covered, you're exposing yourself to the harshness of the weather that comes with dust and all that. Definitely you're going to trigger yourself. Yeah. Yes, to have an episode or whatever that might come up during the travels. Okay. Then some people with diabetes, that most of their medications that needs a time frame to take it, or that needs to be stored in a particular temperature, and the medication is not being taken at that particular time. Yes, you're equally like not taking that particular medication at that particular time. You're abusing your medication, and an emergency might, occur. And another thing is that if you're not well prepared, like packaging the kind of medications you need to while traveling, that's another challenges. There are some few challenges people, experience when they are traveling, either by land, by air, by sea, whichever way.
So, personally, I can relate to that first challenge. You see that aspect of not having where to get medication when you're traveling. Recently, I was on a trip and I had to travel by land. If you know, the distance at which I was seeing bush. If anything just happens to you, it's not like you can't get help. Actually, probably we just look for Babalawo to help you because. So I think, first thing first, if the problem you're having, you're sick and you need to travel, is to buy your medication ahead of time. Don't assume that, when you get to your destination, that is when you're going to buy your medication. Buy everything, pack everything, carry plenty water inside your bag so you don't need anything, because there's a point you get to, especially in Nigeria, and you're not seeing a house. You're not seeing one single living being on the road. You're more of seeing maybe a chemist shop or a pharmacy or a medical facility where you're going to buy drugs. So let's not get to the point of looking for Babalawo along that. So, back to you. Assuming I have a chronic illness and I want to travel, especially if it's travel by land, because if you're traveling by air, there are some arrangements that are already made. There are some medical arrangements. True. Even if you're traveling by sea, except if you're using boats like your Parlink canoe, there's no medical arrangement for that one. But a proper travel, you're traveling, maybe what do they call those things? A ship,
yeah,
there are some medical arrangements. First aid, basic things are there already. So if you're traveling by land, especially if you're in Nigeria, then seriously, you have to prepare yourself ahead of time. So assuming I have a chronic illness, how do I plan my trip so I can minimize the stress? Normally, travel by road is stressful. We've not talked about the pothole and all the ups
the
and downs
and all that.
Thank you so much. So what can I do to minimize the stress I go through when I'm traveling?
First off, there's what we call prioritizing. You have to package. Now the first thing to do is to communicate to your health professional, whether a doctor, whoever that is in charge of the illness or whatever you're going through.
Okay.
Now, he or she is in a rightful position to tell you the medications to go with. Okay. He or she, there are some cases whereby you might need help. I think some of these health facilities get to provide whether a nanny or whoever that can, accompany you to wherever you're going to.
Oh.
That can, that can equally help you if you can't do that by yourself, or maybe there is no relative or anybody to go with you. So the first thing to do is to know the medications you're going with and pack them first. That should be the first thing you do. And equally, communicating, if you're traveling, whether by land or by air or by sea, try as much as possible to communicate with the driver or the pilot or whoever in charge that please, I have, or it's not bad telling someone that you have an illness. Please just try as much as possible to avoid either the potholes or the bumps. In as much as the drivers, they might not necessarily avoid it so well, but at least they will get to try that. Okay, there's a passenger inside that, there's no feeling too well, and I need to drive carefully. That's just it. Then another thing is, I talked about communicating with your health practitioner. Then another thing is please try as much as possible to go for a health checkup, whether 2 days before you schedule, or you I know you've already scheduled, as in one of part of your schedules is just to travel, but at least try and go for a health checkup before traveling. That's even the most important thing. Go there, make sure you're okay. Your health professional is there to tell you, okay, you're fit to travel now, or you are not fit to travel now. You should give yourself some time to rest. And in as much as you're going to travel, please try as much as possible to get enough rest. A day or 2 days before you travel. Rest as much as you can. Not that you're let me use this scenario as an example for someone who is having a heart disease, and you're just jumping up. You're not okay. You didn't go to the hospital for your checkup before traveling, or maybe someone with an eye problem, and either glaucoma or ocular hypertension. You just wake up, you're not really sure about the glasses you're traveling with, or maybe you're not sure of your health, or maybe you just went to the hospital a month ago, and you think within yourself you're fit to travel. You cannot really tell that to yourself that you're fit to travel. Ensure you get to see your doctor or whoever in charge. I am traveling. Then after the test to running and all that, they are there to tell you, okay, ma'am, you're fit to travel. Okay, you can give yourself some time to rest before you can move on with your journey. I think those are the basic things to note before traveling, to avoid emergencies or stress or whatever thing that may come up. Yeah.
Ladies and gentlemen, I have a tip for you. You see all those plenty ashwebi they will call you for. Ashwebi here, ashwebi there, ashwebi the other side, and you know you don't want to go. Just tell them your doctor said you're not fit to travel because you're not feeling fine. Yes. So let's talk about packing your medication, because while you were talking earlier, you made mention of something like some drugs needing to be stored in under certain temperature, and that really got me thinking, because when I'm packing my drugs, for example, I'll just carry everything inside one box and just throw it inside my bag. I likely put it at the center of my bag or my carry-on, and that is it. So if wherever I am is overly hot, all the drugs are overly hot. If it's extremely cold, everything is extremely cold. So what are some things we should take into consideration when packing our drugs? Should there be some sort of a certain type of packing case for certain drugs, or just explain so we don't melt our drugs?
In terms of packing of medications, at least you should try as much as possible to get either a small handy bag or a small handy box. At least there are some ice. We have ice packs and all that for medications that goes with some certain temperature. Yeah, you can get some ice bag where you, and a little handy bag. Yeah, you can put those ice packs inside. Put those medications inside. I think that's another safe way for medications that goes with whether a temperature that goes with some certain temperature. Then for other medications aside from that which you asked, you still get a bag that you know that you can, as in you can just lay your hands on if any emergency occurs while traveling. Just know that bag is the bag where you pack the medications for any emergency. You can just put in your hand and you pick it, whether orally or injectable, or you're instilling in your eyes, whichever way. So just have a handy bag where you put those medications in case of emergencies. Shouldn't be something that you just pack with your clothes together. And if anything gets to happen and they are trying to, they are calling you, ma'am, or sir, please, what are we going to do? Where is your medication? Or do you have any first aid? By the time anybody there who is a medical practitioner, he or she will still need some medical, equipment, or maybe a first aid box to attend to that emergency. In as much as, yeah, there's some, If you're traveling by air, I guess there is always a first aid box there. Yes, when they are using that, equally trying to get to know if there is any other thing you're carrying with that can equally help calm you down at that point.
So do you think it's necessary to maybe tell the next person sitting by your side, especially if you start to feel somehow?
Yes.
Can you let them know that, oh, I'm not feeling too fine, something of the sort?
Yes. And another challenge that comes with this, there are some persons that when they come in, like they don't really find it comfortable, talking to the next person. They just want to, keep it to themselves. There are some persons you might get to tell and they are kind of they give you this attitude, but I know even if the person close to you isn't listening, I definitely know the person either by your left or your right will get to listen to you, and you tell he or she might help out in case something of that comes up.
Okay, let's talk about health insurance for a bit. So if I'm traveling, because I've always thought about this, if I'm traveling, for example, and something happens on the road, at the middle of the road, there's no health facility, there's no nothing. How does my health insurance cover for me in that situation? I want to know.
Try to have the emergency numbers, or there's some numbers to call if any emergency arises. You get to call those numbers there and then. It's either they are to instruct someone who is there to help out on what to do. Since they have the database, they have your biodata of whatever illness or whatever thing or the medications or what to do at that point in time. So when you have their numbers, you call, they give directions on what to do, since there are no hospitals or clinics nearby.
Okay. So that also got me thinking, for situations where it's not I want to believe that, in as much as we're saying chronic is something that has lasted for a very long time, some diseases can be much more chronic than others, and some might be much more easier to stimulate than others. So the slightest thing and you're having an attack because of that. So do you think it's necessary to probably carry your medical reports? Meanwhile, I think there's even this thing that comes with your phones, right? So even if your phone is locked, there's a password, you can. Every smartphone has that in, doesn't it?
Yes.
So your health information can be on your phone, your emergency number, part of your emergency number, aside all your family members and your pastor, your doctor's own should be there. So put your doctor's number, put any other important person you would want to reach out to, some details about what's going on. In the case that you have an attack, what's the medication that you should take and the dosage? So when someone picks up your phone, someone who is aware of this feature, if they pick up your phone immediately, they can see this information and they know how to help you out immediately. So I was going to ask, is it also necessary that one travels with their medical diagnosis, maybe the document, something, hard copy, carry there?
There's something I really want to say about this. I know medical conditions like this are being confidential, so you don't expect someone to carry any medical report, whether in a handbag or envelope or whatever thing, moving around. Yes, the phones everything have been made easier for us to access through the phone, in as much as you still have the emergency numbers to call. When you call, or whoever that is calling them can as well, whoever that is to talk, any professional that is speaking with whoever that called will be the one to direct the person. Please, this is what the person is suffering from. Look at the way to handle it. Do this, do that, do this, do that. What is happening, the person, whoever he or she is communicating with, will get to communicate back what is happening at that point, and the doctor or whoever is still there to direct the person. There are some cases you don't really need to let other persons know about it. just as if someone is having a seizure and there is an episode and everybody is just like people, yes, they want to know, they want to help and all that, but the first thing you need to do is just to clear the place for air to come in.
Okay.
Before you start whatever thing. Or maybe someone that just had a heart attack, and the first thing is to make sure the environment is safe. You clear the whole place for air to come in.
Okay.
You can start up your CPR and whatever other thing. Then you have to pick up your phone, call the emergency number. The health practitioner is there to direct the person that called on what to do at that point in time. You must not really carry your report handy while moving about. It's not really necessary.
Fair enough. Good one. So, just 2 tips from what has been shared, considering that your phone and the data that you have provided is important for people to help you in the case of, any health issues while you're traveling. I think it's also important that you charge your phone. Even though you don't intend to use it, just ensure your phone is well charged and that you have airtime. Load your phone, buy like 2,000 naira airtime, just load it and keep. So that the person who is calling you, in case the person who is trying to help you, in case they don't have airtime, they can use yours. And then another thing also is, your fellow travelers can have airtime, but your medical practitioner may not take the call. In that, they might maybe route it to reception or to whoever, but if it's your own number, and because you've also let them know that you're traveling and they understand your situation, when they see a call from your own number, they will be more apt to take the call immediately so they can provide help to you in time. Dear travel lovers, I have learned a lot from this particular episode, and there's really lots of changes that I'll start making when I'm traveling. But unfortunately, we are kind of coming to the end, and I will let the health practitioner give us a summary of all she has said. So, Dr. Mercy?
Safety, they say, is very important, and make sure that whichever means of transportation you're going with should be safe. Always, the first thing you need to do is try as much as possible to communicate with your doctor or any health practitioner that is in charge of your medical condition. He or she is on the right state of or on the right position to tell you whether you're safe or not safe to travel at that particular time. Ensure that the first thing to pack, not just your clothes, but the first thing to have at the back of your mind is your medications, which are very important. Pack it in a way that it will be very handy when any emergency or anything arises on your way. And another thing, in as much as there are no health centers or hospitals or whichever means of transportation you're going to use, but communicate to the person in charge, whether by air, the pilot by air, the driver by land, that you have a particular medical condition. They are really reasonable people to understand, yes, that this journey, they had to avoid some certain things and for you to be safe. And also try as much as possible to rest before traveling. Make sure you rest before traveling. I know why I'm saying that. I'm saying this because I know of a patient that just woke up and the person was like, yes, I know I'm traveling tomorrow, and not going for checkups, or maybe he or she doesn't know if he's good enough to travel. Ended up halfway, and we are not praying for that to happen. But when you know that you've put in place some vital things and you've arranged yourself, you're good to go, you're fit, you can travel. That you have a chronic disease doesn't mean you can't go anywhere. Yes, I know that chronic conditions don't have any cure, but they can be managed effectively. If you yourself that has the illness or any chronic health condition, you get to abide by the set out rules, listen to your health professional, on what he or she gets to tell you what and what not to do, definitely you live a longer life and be safe out there. So as you're traveling, just be safe.
Thank you so much, travel lovers, for joining us on this very first episode. And please, see, don't allow any kind of sickness stop your waka. Travel this world. Buy Belgium, buy England, buy France. I could say buy Davido before Davido fans will come after me, though. But I mean, you know that if you do what you have to do, irrespective of what condition you find yourself, you can always explore. And I know for sure that there are those of us who are unfortunately confined to the bed. You can't move beyond that point. I'm so sorry that you have to experience that and you cannot afford to travel as much as you want. I really don't know what to say. I'm just so sorry. We do really feel your pain. But for those of you who are not in that condition yet, please stick to medical rules, okay? So you can still live your life the way you plan to. All right, I'll see you in the next episode. Thank you so much for joining us. Bye.